discuss about lung cancer treatment options. Last week, we spoke about understanding the risks, symptoms, and how to determine whether you need to start treatment. Today, we will focus a lot more on the treatment plans and the treatment options that you need to be aware of. November is Lung Cancer Awareness Month, and we will be doing a series of discussions around this. This is the second in the series, and we are very privileged to have with us Dr. Sai Vivek of Aster CMI Hospital, where he practices as a consultant medical oncologist in Bangalore. We're still waiting for Dr. Kripa Bajaj, who's consultant medical oncology from Hyderabad at Basvatarkam Indo-American Cancer Hospital and Research Institute, and we hope she will join shortly. As I said last week, we talked about the risks, symptoms, and treatment options of lung cancer, and you can find the recording of this on our YouTube channel. And just a quick reminder, Patients Engage is an online platform for patients dealing with chronic diseases and their caregivers to share experiences, to learn from each other, as well as from healthcare professionals. And also, the better informed they are, the better decisions they will take. And also, the more they engage with the community, with, there are other people who are dealing with the same condition, they will not feel isolated and alone. We have always, Patients Engage has always put patients and survivors at the center of all of our content. And even the discussions we have with healthcare professionals are based on the questions we receive from patients and, what they find challenging in the journey. And we talk about different aspects of dealing with cancer, as well as how it impacts their personal lives and relationships and mental health as well. This series is supported by Pfizer. The content of this video is meant for information and awareness purpose only and is not a substitute for medical advice. So please do consult your doctor for guidance on the information that is given here, or reach out directly to our speakers who are experts in this field for a consultation. And the views expressed in this discussion are of the speakers, and Pfizer or Patients Engage may not necessarily endorse the same. And I'm Aparna Mittal. I'm the host and moderator for this discussion. I'm also the founder of Patients Engage. I think Dr. Kripa Bajaj is just joining us. So welcome, Dr. Kripa. Look forward to seeing you on video shortly. As I said, this discussion is for general awareness. And while you're watching this, you can post your questions on Zoom, Facebook, or YouTube, where we are streaming live. And we can also pick up the questions later on. So you can write to us at editor@patientsengage.com. So let's get started in the meantime. So Dr. Vivek, if you can start by making sure that we are all on the same page, what is lung cancer?
Yeah, so lung cancer is the term given for any tumor or a malignancy arising from the lung tissue. So initially, I think 20, 30 years back, we knew only two major varieties of lung cancer, non-small cell and small cell. But as we got along in the last 2 decades, we were able to differentiate non-small cell into multiple other variants like squamous or adeno. Now, in the last 10 years, that has gone deeper and deeper. So in non-small cell itself, we are able to categorize patients based on the changes that occur at the DNA level. So that has been the advancement in the last 20 to 30 years in lung cancer, which is nothing but a tumor arising from the lung tissue.
Right. Thank you. Welcome, Dr. Kripa.
Hi, Aparna Mittal. Nice to talk to you.
Nice to have you here. Dr. Kripa, can you talk through the stages of lung cancer?
Usually, any cancer will have 4 stages. So the stage 1 to stage 2, technically we call it a curative intent cancer. Stage 4, we call it a non-curative intent cancer. And we try to palliate, means we try to prolong the lifespan of the patient by giving some sorts of treatment, both it involves chemotherapy, targeted therapy, radiation therapy, and everything. Till stage 4, As per the stage, we try to give surgery, chemotherapy, radiation, depending on the stage of the tumor.
Okay. And what exactly does a staging mean, right? So can you talk us through the fact that, whether the cancer is localized or whether it's spread? So if you can explain that.
So usually lung cancer, just like a blood supply. So any cancer for that matter, not just lung, there be a primary focus, the location where the cancer is arising from. From there, the cancer cells will circulate. Just like a blood system, there is a lymph system is there, the cancer will circulate and deposit in some places. If it is regional, means the cancer hasn't spread somewhere else in the distant part of the organ, we call it a curative intent. Up to stage 3, the cancer is confined to lung as a supply of the nearby lymph nodes. So when it's restricted to such stage, we call it stage 3 cancer. If the cancer has, metastasis or traveled to some other parts of the body, we call it stage 4. Technically, we can't cure that kind of cancer because cancers will circulate throughout the blood actually. So it can deposit anywhere else. If there is a favorable niche area somewhere, like it can deposit, it can grow there. So we can't cure the cancer, we can't remove it surgery or radiation at all the focus. So that's what we call it a non-curative. We try to give some systemic therapy and treat that cancer with this administration of systemic agents. Yeah.
Right.
Am I clear, Aparna?
Yes, you are. Thank you so much, Dr. Kripa. Dr. Vivek, is there something called the types of lung cancer?
Yes, there is something called types of lung cancer. I was just mentioning, the broadly non-small cell and small cell. It is just based on their appearance on the microscope. People have started calling it non-small cell and small cell. Small cell happens to be 20 to 30% of lung cancer and happens to be the more aggressor. Smaller the cells, they can get deposited in different organs easily. So they can seep out of the blood vessel. So small cell and non-small cell. In non-small cell, we have one which mainly is seen in chronic smokers, which is squamous, and adenocarcinoma is seen in not heavy smokers. So these in broad are the types of lung cancer from a microscopic view. But going deeper, non-small cell is again divided into multiple molecular types.
Right. And if you can just talk us through the molecular types as well.
Yeah, so in adenocarcinoma that we just spoke about, which is more common in not so heavy smokers, what happens in here is these are seen in younger population, predominantly women and of Asian descent. So India falls into that. So there we go inside and look at the DNA of the tumor. So in the DNA of the tumor, we look for known changes in the DNA which are abnormal, known as mutations. And based on these mutations, we call it either EGFR mutated, ALK mutated, ROS mutated, NTRK, HER2, so on. Around 12 to 13 different mutations are searched for as of today. Why only these are searched for is most of these small changes in DNA have certain tablets which are available, like diabetes and hypertension. You can just take a pill a day, and these are superior to the chemotherapy which we were giving 20 years back.
Right. Thank you, Dr. Vivek. Dr. Kripa, if you can also explain how, I know you were talking us through how the different stages of cancer affect the treatment, but how does types, does types play a role as well? And do you look at both types and stages? Because often we have patients who will say XYZ had this stage of cancer, but got this treatment. Why am I getting a different treatment, right? So we just want to make sure they understand how this is arrived at.
So usually, as Dr. Vivek already mentioned, just like a types of human, there is 4 types of cancers we do have. Usually it's a adenocarcinoma, squamous cell carcinoma, large cell carcinoma, or neuroendocrine for that matter, and small cell carcinoma. So depending upon it, like we do have some analysis at the baseline. So the workup will differ at the basic level itself. So usually adenocarcinoma, as Dr. Vivek already mentioned, it will have a lot of targets. When females are there who are non-smoker males, we do often see targets actually. And and in this one, adenocarcinoma, there is a place of targeted therapy at every step. At even the stage 4, even the early stage post-surgery, there is a target therapy role is there if it's positive. And a lot of data is coming up for different types of targets, even the curative setting also. And there is very, very well established data for few targets. And immunotherapy will be there across all the types. We do assess what percentage of cells will have a predilection to get response to the immunotherapy. Depending on that, we will offer the immunotherapy even in the curative setting as well as a palliative setting, means the metastatic setting as well stage. So the chemotherapy backbone will be there in all the cancers, and different types of pathology or different types of cancers, we do choose certain regimen. So all regimens will not work for single cancers. In the sense, one type of cancer will respond to one kind of chemotherapy, other kind of cancer will respond to other kind of chemotherapy. Plus or minus immunotherapy based on certain test actually. Yeah.
Right.
Am I clear,
Thank you.
Aparna?
Thank you, Doctor. Yes, yes. Thank you, Dr. Kripa. I think, Dr. Vivek, we were talking earlier as well on the tests that are required before the treatment gets started. So, and I know both of you have mentioned, the existence of targets, but can you explain what is, molecular or genome profiling, and what is the role in deciding treatment
Yes,
sequence or regimens?
So once we are suspecting someone to have lung cancer based on a simple X-ray or a CT scan, we ask ourselves two simple questions. What is it? Where all is it? What is it is demonstrated initially by a biopsy, which is done by a radiologist or an interventional radiologist. So once the biopsy goes into the lab, the pathologist takes over. Coming to the other thing, then we do a SPECT CT or a CT of the whole body to see what is the stage, as we have discussed before. If is it localized, or is it loco-regional, or is it distant? These are the three parameters we can broadly put everything under. And going back to the pathologist, then the pathologist goes through a flow chart. Non-small cell, small cell. Then she goes into in non-small cell, adenosquamous or large cell. In adeno, they tend to send it for higher testing. This is not done in every pathology lab. It is sent to a specialized lab where they extract the DNA and RNA. Basically, they extract the DNA and RNA of every cell and then start running certain tests with specific probes called PCR, or they even do something known as comprehensive genomic profiling, or the next generation sequencing is a technology used to do comprehensive genomic profiling to look for the status of these mutations. So it happens at two different labs to simplify it. One at a routine pathology lab, you know the outline of it. Then for the in-depth genetic information, it has to undergo something known as next generation sequencing, where we are literally sequencing the genes, which all of us have. That's the coding material. And then those genes are read into and compared to the normal ones to see if the patient has a normal gene or an abnormal gene. Abnormal gene is equal to a mutation which can be targeted.
Right. Okay. Thank you. Dr. Kripa, we've talked of the various treatment options, and most people are generally aware of side effects of chemo that gets discussed all the time. But can you also let people know what to expect if they are, on targeted therapy or immunotherapy as well?
Yeah. So usually immunotherapy will cause certain side effects, just like the primary mechanism of immunotherapy is to activate the immune system against your cancer cells. In the meantime, it may sometimes attack the normal cells as well. So some people do have a hypothyroidism. Most common thing what we do see with immunotherapy side effect is the hypothyroidism. So thyroid levels may fluctuate, hormone levels may fluctuate. Sometimes they can have a diarrhea. They can have some increased respiratory distress because of the inflammation in the lung. Because of the hyperactive immune system, there can be inflammation in the lung as well. So technically, some people do have a hyperinflammatory syndrome. So that's why different organs can get affected. So the most common thing we see is a hypothyroidism. Target therapy, you see, it's a very well tolerated, just like the diabetes medication, hypertension medication, just one pill. And it's a very rare to discuss regarding the side effects of target therapy. The most common thing what we do see, the first generation kind of treatment when we give, the very the starting one,
Early
what
stage.
is easily available, affordable. It's not early stage. The target therapy, which was first to invent the kind of thing. So right now, third generation drugs also have come, but usually still it's because of its unaffordability. We still use first generation for many people. So
Right.
that target therapy may cause diarrhea, some skin rash, sometimes it may affect the nails and all. And some target therapies can cause a liver function derangement, all this kind of thing. So these
Right.
kind of side effects are very manageable, the target therapy one. Immunotherapy is also very manageable. Only in most of them we do see hypothyroidism, and very rarely we see pneumonitis, all these things. So that's also, very rare complication to see. So relatively compared to chemotherapy, target therapy and immunotherapy is very much well tolerable.
Okay, thank you. And Dr. Vivek, in terms of, we talked of these as some of the side effects and long-term toxicities as well. How does that affect the routine that so, when you ask patients for a follow-up routine, in addition to seeing an oncologist, and what is the routine for an oncologist, and what other specialists or, physicians do they need to see?
Yeah, I think that's a great question. I think what every patient in oncology needs is for them to see their primary care physician or a clinician who's treating them. Along with it, I think a holistic approach in terms of nutritional support, in terms of even oncopsychologist being there, where in the initial diagnosis is like shattering a glass for any particular person. So their dreams and their aims in life are just come to a standstill in 10 minutes of talk with the oncologist. So that's when I think the hand holding needs to start, that yes, it is cancer, we understand, but that is not the end of the road. There is light at the end of the tunnel. With the advancements, a lot of people can go on for a good 4 years, 5 years in certain types of lung cancer to ALK positive stage 4. We're seeing people go way beyond 5 to 6 years. They're becoming more of a chronic condition like a liver failure or a kidney failure rather than a death sentence in the next few months. In the few people who are not eligible for all these, take up only chemotherapy also, I would agree that the medicines in chemotherapy haven't really changed much. But the supportive care medicines that we give along with chemotherapy have developed leaps and bounds in terms of medicines to reduce the nausea, vomiting, which is a major side effect in the initial few days. So one thing that I always tell them is, see, in day 3 to day 9 of after a chemotherapy, you can encounter these
Expect.
side effects, expect
Right.
or encounter, but there are multiple medicines if you're in touch with the oncologist which can make it go away in the next couple of days or one day. So those medicines
Right.
are the ones which have really come up in the last few years. Along with that, as Dr. Kripa was mentioning, immunotherapy side effects, these in a way tend to be rarer than the chemotherapy side effects, much much rarer than the chemotherapy side effects. Apart from that, one more thing is they can affect any body organ. So it's like you're potentiating your body's army. It fights the
Right.
bad guys, but by mistake it
It
also
also attacks.
tends to find the good guys. So head to toe you can have inflammation of the eye, inflammation of the lungs, heart, intestines, thyroid, whatever, but that is much rarer and can be managed. It's not as bad as chemotherapy. And targeted therapy, usually though they take it for years together, side effects are usually for the first 6 weeks to 8 weeks. Post that, people take it better than a BP or a sugar pill, I would say.
Okay, so there is no need for them to go see a cardiologist regularly or an endocrinologist regularly, etc. Is that
Not regularly, not regularly, but there are time points at which when they're visiting us, we tend to check for whether there are any off-target effects, and then we tend to include them in the plan. So once we find something and we include the cardiologist or an endocrinologist, then the follow-up becomes a little more broad.
Right, right. Thank you. Dr. Kripa, can you also talk us through the role of exercise and pulmonary rehab for lung cancer patients?
I would say pulmonary rehab plays a very important role, be in the starting stage or the late stage. So usually, patient post surgery, some part of the lung will be removed, like either the whole lung or half of the lung will be removed. Those kind of patients has to cope up with the rest of the lung, like other lung or like half of the lung, with a good exercise, with good improved respiratory capacity. We would say we strongly ensure before surgery as well as post surgery the respiratory physiotherapy. It's very important. They have to get adapt to the new normal. So how they can adapt is like only to increase the efficacy of the remaining lung. So our
Right.
body is a very intelligent. It can cope up with the remaining lung in a very well manner with a proper support system. And post radiation, the post surgery part I just explained. Post radiation also there can be some fibrosis. See, just look when we have some wound, there can be a scar on the body or something. Just like lung also in the similar manner will have a scar. So it will not expand to the extent what it is supposed to. So post radiation, the inflammation will be there. If we leave just like that, the lung may collapse. In order to prevent it, we have to do a certain exercise, good respiratory physiotherapy, which will enhance the capacity of the lung. In the metastatic setting, there the lung capacity is not so great, and also most of the times people do have a smoking history prior. The COPD component will be there. So these kind of patients, we do give a supportive. We do include pulmonologists very much in the involvement in the COPD patients, be it a curative or metastatic setting. The optimization of patient plays a very important role at every step with the pulmonologist support or be it us with the respiratory physiotherapy support. So yeah.
Right. Thank you. And Dr. Vivek, what about the role of nutrition for lung cancer patients?
Yes, I think
What is the
there is no
advice there?
specific nutrition for lung cancer patients. To generalize it for any cancer patient on chemotherapy. See, nutrition again doesn't play a huge role when you're taking targeted or immuno. So to just focus on chemotherapy, one thing is there are a lot of myths going around. Even recently, there were a lot of people trying to debunk those myths, but people have stopped eating sugar, people have stopped eating multiple things, meat and even protein. But those things have never been scientifically proven. Those are anecdotal things that a certain patient has benefited, but in a long term or a multiple people getting tested and then research has never proven it to be beneficial. So I would tell them to eat what they have been eating all their life. You might not be able to eat in large quantities. Reduce the quantity of food and increase the number of meals per day. Every person needs a treat for their brain. I think you're good to have an ice cream once in a while. You're good to go out and eat a dessert once in a while. And you need protein because the amount of protein actually reduces the amount of side effects that chemotherapy and other medicines can cause. So eating adequate protein is very essential.
Right. Yeah, and I think that becomes especially an issue, right? Especially if you are vegetarian and then you decide to cut off dairy and a couple of other items, then they really do struggle with weakness as well. So in terms of one question that we had received was whether any of these treatments have any effect on fertility and sexual health, Dr. Kripa?
Yes. Usually any chemotherapy will cause the effect on the fertility. Whenever they want to plan the kids, post chemotherapy, we usually young people, we try to suggest them to go for the sperm preservation or oocyte preservation. Usually chemotherapy will have a predilection to affect all the fast dividing cells of the body. So in the meantime, as a part of it, they have an affection of this fast dividing sperms or oocytes. So that's why they have a fertility sparing. But why? I mean, whatever said and done, because of the chemotherapy, whatever the regimens we use, only 30 to 40% issues will be there. 60% of the times it's not a problem. But because to ensure the 100% fertility, because of the post chemotherapy effect, we suggest them to preserve their eggs, embryos, or sperms before. Coming to immunotherapy or target therapy, whenever target therapy is there, like if it is a curative setting or both fertility preservation aspects will be offered to only to curative setting, not to the metastatic setting. So whenever we are offering target therapy or immunotherapy, we specifically don't suggest them to preserve the eggs or sperm because there is no proven theory that it will cause infertility. So immunotherapy, as Dr. Vivek already mentioned, we mentioned before, it can have effect on the hormones. It can affect the thyroid. It can affect your testosterone levels, estrogen levels, and everything. But once it got stopped, everything will fall in place very soon. Whenever patient is having excessive fatigue only, then we will intervene. Otherwise, it will not affect your fertility as such because it's a reversible thing once we stop the immunotherapy. Unlike chemotherapy, which will cause irreversible damage.
Right. Okay. And Dr. Vivek, in terms of, I know you touched on the importance of onco-psychologist. How do you propose that? Because there are not too many onco-psychologists available as well. So, what is your recommendation for patients who are struggling with, or lung cancer patients who are struggling with emotional issues? How can they deal with this?
I think in certain scenarios when they're not available, I think an oncologist should don another hat of being someone who's able to sit with the patient for a longer time, talk to them openly. It takes a while to break that barrier, but once you form that bond, you're able to understand what are the things that are going on in a person's head. If they're scared of what is going to happen to them in the next 6 months, that can manifest itself as pain. And whatever painkiller you're going to give them is really not going to benefit them unless they calm down about that particular aspect and particular solution is sought after and told to them. And nowadays, I think in the era of Zoom and online, a lot of people can get the help of people who are doing online counseling. And counseling is not a one-time thing. I don't think it is done with a one-time thing. That family push to do it repeatedly at a frequent level will actually encourage them to be more positive towards the outcomes of the disease. And more often than not, they tend to tolerate the treatment well with lesser side effects, someone who's more positive. So that is why it should not be only an oncologist or only a psychologist. It should be all packaged into one in terms of a holistic and comprehensive care.
Right. And in your experience, and Dr. Kripa, you can also weigh in, what is the kind of support that the family members of lung cancer patients need?
The social support,
again,
you mean?
Finish, yeah.
Sorry.
You can go ahead, Dr. Kripa, once you're done, yeah.
So lung cancer patient, they should have a option of navigating what are the treatment options available, what is the best, because the plethora of the research had happened. So, patient advocates are very important in the lung cancer, breast cancer, because someone should be there to understand what is important to them, how can the sources can be procured and all these things. So, VCare is doing a wonderful job. Like, we are having a lot of patients get helped by the VCare Society. So people should have a right person to navigate towards the right resources. This is the most important thing I would say. Apart from the support system, the technical aspects, what we spoke, apart from the medical oncologist, psychologist, dietitian, it's a very important part to the management of entire cancer treatment, because of the fluctuation in the nutrition levels, patient will become more sick. He may have a motivation to lose. He may have his motivation like to get deteriorated, because cachexia look will make a person to lose the what is a morphological idea of his own body. So all these aspects of why I'm losing so much of weight, why I'm becoming like this, so I can't go to any functions, all these things are there. So psychological support, dietitian support is the most important. So it adds on the layer on the cake, whatever we are having the treatment. So holistic approach is very much important. So apart from the primary surgeon, primary medical oncologist, the fine aspects of the patient has to be taken care, and the procurement of the drugs are also very important for certain set of patients. Already we discussed different targets are there. So all these aspects I do suggest. I request Mr. Vivek to add on the any other aspects I missed.
Yeah, I think that was well said by Dr. Kripa. I think it has to be taken up at different layers in terms of patient and also caregiver issues. They will also have issues in terms of economics on how they're going to bear with the treatment of something which has just been delivered to them in terms of a diagnosis. So a lot of support groups which are slowly coming up in at least the cities in our country are helping in certain way, and patient advocates are very much prevalent in the West, but not yet caught up in countries like ours. I think that's a good way to start. And nutritionist, onco-psychologist, along with these two, and the oncologist needs to be an essential part of it. I mean, he's the one who's supposed to be the driver who organizes all these things and make sure they're happening at the same pace as the oncological treatment. And only then the outcomes will definitely improve and match up to the standards that the West is seeing for a while. Because the treatment is literally the same. We are not giving anything different. So it's basically the other things which are making a difference in terms of compliance. So if we address the psychosocial issues, I'm sure patients will be more compliant to treatment, hence definitely show better outcomes.
Right. Thank you. Dr. Kripa, your final message to patients navigating lung cancer treatment, what would you want them to know?
So I suggest all the patients who are having a smoking history or who have the chronic cough to get evaluate with a proper physician. If ever any suspicion is there, please don't waste your time getting bronchoscopies done, this and that. Just meet an oncologist who is nearby. They'll support you and they'll help you. Whenever you have any issue, go to a holistic tertiary care center or somewhere. They'll support you by all means, be it financial terms or everything. Like everything we I'm right now, I got trained and working in tertiary cancer care center where we are taking care of all aspects of the patient. We just mentioned before the fertility. We have an in-house fertility specialist post chemotherapy. Whenever they're having any fertility issues, we are sending across for the IVF procedure or IUI, like whatever aspects. So any tertiary care center you can approach, you can seek help from them. All of us are here to help you. So with any means, like we are here to help you. So yeah, please.
Right. Thank you. Thank you, Dr. Kripa. Dr. Vivek, your final message to lung cancer patients, navigating lung cancer diagnosis and treatment.
Yeah, so I think I think screening is very important. Anybody who is having significant history of smoking, it's not wrong to just walk up to a doctor and say, do a low dose CT. That is going to be the difference between having the complete life versus shortened life. Secondly, okay, you're diagnosed for whatever reason. Now, the medicine itself is changing from just conventional hitting everybody with a carpet bomb like chemotherapy to more tailored and precise. It's the era of precision medicine. So in this era, everybody, irrespective of the age, even 89, 90, can be given some treatment which they can tolerate and make their day-to-day activities better. So try to meet a doctor, try to get a good understanding. It's not the end of the road. We are getting way better compared to what we were.
Right. Thank you. Thank you, Dr. Vivek and Dr. Kripa. I think to our audience, I think has been very clear from this discussion that while early diagnosis is important, and if you are a smoker, please do proactively, look for screening options. But also once you're diagnosed, there are now treatment options and people live with lung cancer for many years. So, you get better quality of life as well as better overall survival as well. So I think it's important to not be afraid, to understand your treatment options and to adhere to the treatment plans. And also look at, as we talked about, the various aspects of supportive care that, are available, whether it's management of side effects of treatment, whether it is psychological support, whether it is support groups that you can reach out to, fertility specialists, and just discussing aspects with your treating oncologist as well. So thank you so much, Dr. Kripa and Dr. Vivek, for taking the time to talk to our patient groups on this on the topic of navigating treatment options for lung cancer.
Thank you.
Thanks, Aparna, for this wonderful opportunity to participate in this platform.